Shruti, over to you.
Good evening, everyone, and welcome to our special World Heart Day webinar series. I am Shruti Bharadwaj, a proud volunteer at Project Step 1. I welcome all the doctors, teachers, and administrators on this panel. Project Step 1, being a volunteering organization, let me start the session with the quote. Volunteering is at very core of being a human. No one has made it through life without someone's help. So well said that no human can survive without a fellow human's help. The ongoing COVID-19 pandemic has made humanity face an unprecedented crisis, but our doctors and medical team have proved to be the heroes over the past 180 days. Our Project Step 1 doctors have made great impact on 5 million lives, have done more than 750,000 consultations, and have been successful in preventing more than 5 million contacts. Dear doctors, Step 1 and citizens need just 30 minutes of your everyday life. Your 30 minutes every day can save thousands of lives. Give a missed call on 080-471-92219 to join the largest doctor volunteer group. About today's special webinar session, cardiovascular diseases are the #1 cause of death worldwide and is projected to remain so according to WHO. About 17.5 million died from cardiovascular diseases in 2005, representing 30% of global deaths. Risk factors that may lead to heart disease and stroke include raised blood pressure, cholesterol and glucose levels, smoking, inadequate intake of fruit and vegetables, obesity. World Heart Day was created to inform people around the globe that heart diseases and stroke are the world's leading cause of death. Today on Step 1 panel, we have a wonderful team from Heart Rescue India in association with PediSTARS India. I welcome you all, doctors. Heart Rescue India's mission is to improve the health of populations and individuals around the world to reduce health disparities by collaboratively conducting transdisciplinary research, training, and the next generation of global health leaders and building the capacities of global and local partners. Their purpose is to make the UIC-COM a national leader in global health by expanding global health research, further developing medical and graduate global health education, building a network of global and local partners, and promoting the visibility and sustainability of global medicine. Without taking much time, I welcome all the panelists, teachers, and administrators for today's webinar session. And moderator for today's session is Dr. Aruna C. Ramesh. She's a professor HOD Emergency Medicine from Ramaya Medical College and Hospitals. She's a State Advisory Committee Disaster Management member, Government of Karnataka. Heart Rescue India Program Director, Bangalore. Honorary Distinguished Faculty Member, UIC Chicago, USA. She's also the Honorary Officer Commanding Casualty Services, Civil Defense, Bangalore. I welcome you all, and over to you, Dr. Aruna. Dr. Aruna, you're on mute. Can you unmute yourself? Thank you.
Thank you, Shruti. Yes, we have to thank Step 1 and PediSTARS for giving this opportunity to work together and getting our act together on World Heart Day. Indeed, Heart Rescue India has started off with a mission to save lives for patients who are having a heart attack. Recognizing a person is having a heart attack, calling the toll-free number or 108 and ensuring they reach the hospital in time is a mission that we have undertaken. So we have with us the panelist of today, and I'm going to call each one of you on the panel, distinguished panel from the international and national front. So I request each one of you to introduce yourself. Geetanjali to start off with, especially because she's heading the PediSTAR group of PediSTAR group in this mission. Geetanjali, over to you, please.
Thank you. Thank you, Aruna.
On behalf of PediSTARS, I welcome you all on this special day. This is the third episode we are doing with the theme, helping the children to help nation during the COVID lockdown time. And a bit about PediSTARS, could I share my screen, please? Pediatric Simulation Training and Research Society India, PediSTARS. It's a voluntary organization founded by Rakshay and myself and another colleague, Sujata. Over the 7 years, we have hundreds of doctors and nurses across the country who have joined us in this simulation training. Simulation training is nothing but doing learning by doing instead of learning to the textbooks. So you can see our volunteer doctors and nurses have trained hundreds and thousands of doctors and nurses across the country. Apart from that, what we have realized is our assets are our citizens. So we have traveled outside the hospital to train the citizens, the public, the police, auto rickshaw drivers, and the bus drivers in another area which has high mortality in India, that is road accidents. So our volunteers, we are simulation training them, and it's called Active Bleeding Control Program. They have trained thousands of volunteers, our team, and many lives have been saved. Apart from that, we have started a program for the children to combat the COVID. First one was to listen to their fears and help them manage the COVID and also to lead a productive life. And the second one we did recently, this is the third special episode that is for the World Heart Day. So welcome you all again on behalf of PediSTARS, Project Step 1 and Heart Rescue India. Over to you, Aruna.
Thank you, Geetanjali, wonderful, yes. So together we are going to rock the world with our efforts to save people from having heart attacks, and especially in this COVID situation. In order to save time, we would request each of the faculty on the panel to actually introduce yourself and tell briefly on the work that is being done at your centers. Can we start off with Dr. Naresh Shetty, please? We go into the introduction of the faculty. Sir, unmute.
Yeah, okay. I'm Dr. Shetty here, and I am in charge of the Ramaya Memorial Hospital, and also I'm in charge of the international program. I'm an orthopedic surgeon, but I help a lot of people doing their work, and I'm basically a supporter of any mission that's going to help the country. Thank you.
Yes, please. So, Dr. Prabhakar.
Hi, good evening. This is Dr. Prabhakar. I'm from University of Illinois College of Medicine in Chicago. I'm an Associate Dean for Technological Innovation and Training. I'm also Senior Associate Dean for Research. My regular job is I'm a professor in the Department of Microbiology and Immunology. And I work on COVID-19 related research, particularly as it relates to drug and vaccine development.
Dr. Terry.
Rhoda, thank you. I'm Terry Vandenhoek. I'm an emergency medicine physician at University of Illinois, Chicago. I'm also project leader for Heart Rescue Illinois, a state of about 12 million people in the United States. And we have worked very hard with school children to teach CPR in the communities. We more than tripled bystander CPR rates for cardiac arrest and more than doubled survival in our state. Now we are working with them to increase access to care for diabetes, hypertension, and they're also helping us to follow up on our COVID positive patients through phone calls. It's nice to meet everybody today.
Dr. Marsha.
Hi, I'm Marsha Edison. I'm from the Department of medical education, the Department of Emergency Medicine, and the UIC Center for Global Health. I'm a PhD doctor, not a medical doctor. My specialty is education and evaluation, and I've been working very closely with Dr. Hari Prasad for the school programs here in Bangalore. Thank you. Nice to meet you all.
Dr. Pedro.
My name is Pedro Barros. I'm a cardiologist from Brazil. I'm one of the coordinators of the Heart Rescue here in Brazil. I work with chest pain units and telemedicine, and it's a great pleasure to interact with you today.
Thank you, Dr. Pedro. Dr. Hari Prasad.
Hello, everyone. I'm currently working as an assistant professor in the Department of Emergency Medicine. I work with Dr. Aruna. But today, I think my role here is someone who's been taking care of the school program of the Heart Rescue India, along with Dr. Aruna, and we work closely with Marsha and the rest of the team at UIC. So, thank you.
Dr. Zize.
Hi, Aluna. Good evening. Good morning. I'm Zize Jiang, professor and chair of Department of Global Health at Peking University in Beijing. I'm the Heart Rescue China Program Director. Has been working with Aluna and Dr. Shetty over the last, and also, of course, UICT the last 5 years. And we are very excited to see the progress and everything that we have accomplished, and really very excited to see this event. And in China, we have done similar program to educate the public. And in addition to the World Heart Days, we also have specific design for emergency call. When in China it's the 120. So we have 2 events in January called the Day 120, and also in November 1120. That's November 20th, also our education days, to make sure that talking about 120. First, I was talking about from the sign, from the onset of sign, get to the hospital and have a blood vessel reopened within 120 minutes, and also make sure to call 120. So really look forward to see the program tonight. Thank you.
Thank you, Zize. Dr. Rakshay.
Hello everyone. I'm Dr. Rakshay Shetty. I'm a children's specialist, and I head the pediatrics as well as the pediatric intensive care program at Rainbow Children's Hospital, Bangalore. And my interest, apart from pediatrics and pediatrics ICU, is also looking at ways of improving outcomes of children. And with that intention, like what Dr. Gitanjali mentioned, we started this society called as PediSTARS. And through this society, we've been running programs across the country, predominantly focusing on resuscitation and emergencies, so that people can respond better. So I'm really excited to be part of this program. Thank you very much, Dr. and Stefan, for having me in this panel discussion today.
Thank you, Rakshay. Now we go. Ms. Ria.
Hi, everyone. My name is Ria Begaman. It's a pleasure to be here today. I am the Director of Administration at the University of Illinois. I have worked with Aruna and the Heart Rescue team over the last 5 years. It's been a wonderful opportunity to meet everyone and share and learn. So thanks for having this event, and we look forward to a great seminar today.
Come in, Dr. Nayanjit.
Thank you, Dr. Aruna, for inviting me. I'm Nayanjit Chaudhary. I'm a medical doctor and a public health professional. I work as the Senior Technical Advisor for Global Health at Medtronic Foundation, Minneapolis. But I'm based out of Bangalore right now. It's been an enlightening journey for the last 5 years working with Dr. Shetty and Dr. Aruna, so as with GJ, Dr. Terry Vandenhoek, Marcia, Ria, Dr. Pedro, and all the Heart Rescue Global Program. Medtronic Foundation has been supporting this program. So, and also I serve currently as an honorary advisor to Ramaiah International Center for Public Health Innovations, as well as a visiting professor at the Ramaiah University. Great pleasure. All the best for this seminar today. Thanks.
Thank you, Ranjit. So Heart Rescue India, in coordination with UIC Chicago as the knowledge partners, and also helping us in bringing in the Heart Rescue program from Chicago and sharing our experiences with us from Brazil and from China, the international faculty who are here today, we indeed have to be thankful. And all this was possible only because of one team, that is Medtronic Foundation. And we were able to achieve this in the last 5 years. Indeed, it has been an interesting journey, a very good learning, and hopefully we'll be able to make a big impact in the near future. We have to thank all the faculty, the students, the teachers, and the principal who are giving their time today and actively going to participate in this program. So I asked Dr. Naresh Shetty to tell a few words on the schools that have helped in creating awareness in cardiovascular diseases, especially in this COVID situation. Dr. Naresh Shetty, your views on this, sir?
I think it's a very important program, the school awareness program, and I think there's a saying, catch them young. And I think no better time than to catch these children at the right time, make them understand what is cardiac arrest, what is myocardial infarction, or what is stroke, and know what are the signs, and also tell them what are the reasons that this can happen, whether it's smoking or otherwise, tobacco, eating, and all those things. So when you try to get these children onto the right side, I think things will improve. They will be better citizens, as well as they will ensure that the community at large will also improve. And I think the best thing is to catch these children as early as possible, make them understand why it's so important. And it's good for the country also.
Thank you, sir. Dr. Krab, you have informed that you are working on the COVID situation. And actually in UIC, a lot of work is being done for the COVID diagnostics and also in the, I think, immunization program. From your experience, can you tell the children the safe practices that they need to follow during this COVID crisis?
Thanks, Aruna. The most important thing that children have to appreciate is that they are what are known as silent carriers. Children are not as susceptible to corona, to infection as adults are. So many children will be infected, but they will not have any signs or symptoms. But however, they can readily transmit the virus to others who might be at a higher risk for developing signs and symptoms of the disease, and including requiring hospitalization. And therefore children have an extraordinary responsibility to keep themselves safe so that they will not unknowingly transmit the virus to others. So what are the best ways for children to remain safe? Number one, please wash your hands for at least 20 seconds with soap and water, and keep your hands clean as much as it's humanly possible. Number two, please wear face masks and you wear them properly. And number three, when you cough, sneeze, or even if you want to speak loudly, please use your elbow so that when you cough, your cough goes into your elbow and not into your hand like this, because when you do that, when you touch other surfaces, you're going to transmit the virus. Or if you shake hands, you will transmit the virus. So the best way to sneeze or cough is to cough into your elbow so that the virus is not on your hands and that you do not touch it. So those are some of the fundamental principles. Of course, to the extent possible, especially if you're not wearing a mask, please maintain what we call a social distance of at least 6 feet. So you should be about for 6 feet away from another individual, so that if you are a silent carrier, you're not going to transmit the virus. So those are some of the easy and ready things that children can do to protect themselves and also protect others. Thank you very much.
Thank you, sir. So I thought you had a question for ZJ. You're on mute.
Yeah, Dr. Zhang, thank you for joining us from China. So one of the interesting things is, COVID-19, it started in China and it has been, although reasonably well controlled, but still it has posed, some significant problems, particularly for schools. Could you please share with us your China experience in how they were able to restart the schools and how the students are being protected?
Well, very good question, Prof. Well, certainly in China, since January and in Wuhan and Hubei province, and certainly the first 2 months of lockdown in the entire city and also the province really has created an opportunity for other provinces to be prepared and to ensure that the virus would not spread to other parts of the country. So after the significant amount of time and spent for a lockdown, and the fortunate one actually starting in September, our school has reopened, and the university has returned to fairly normal situation. But of course, we are really concerned about the second wave of outbreak. One thing I think that is really important that, as Prof just say that where masks will play an important role. The social distance is also important. I think the first phase, well, in China, we call that the 5 stage of containment, starting in the epicenter in Wuhan. Of course, for that period of time, everything is totally shut, and the in and out community was restricted, and so now the situation has improved, but the concern is still there. And the good thing that we believe that the population testing for the virus has been widespread, and to make sure that we don't have these positive patients running around. And the second point, of course, I think locally, disease control agencies has been very cautious about any potential issue. So, but right now that majority of cases are really imported cases from abroad, and but with 2 weeks of quarantine, and things has been under control. But domestically, and we don't have domestic cases, new cases for the last 6 weeks. So I think that's at least this is a very positive situation for China. And so for school, again, well, it's really important that just use a preventative measure, as Dr. Pro just described. Well, wash hand and social distance, wear masks, really important. And we'll hope that the situation can rapidly improve in the near future in all countries, certainly.
Thank you, Dr. ZJ. What works in US, as Dr. Prab said, works in China, works in India, and across the world.
Right.
So take care, children, and follow the rules of staying safe. Masha, I see that you have a question. Go ahead, yes. Masha.
Thank you. This is a question for Ms. Renita, who's one of the school principals. The students in your schools are all taught the anatomy of the heart and how it functions. But our question is, do you think that science classes where you learn that anatomy should include heart attack? Heart attack?
Yeah, I hope we are not getting a heart attack.
Oh.
Yes, I think that practicality of the situation is, just a minute.
There must be 2 devices that has been logged on. Yes.
Okay. So I think
you're muted. Miss Renita, you're muted.
Renita ma'am, if you have opened the Facebook page, I mean Facebook on your phone or laptop there, please close it and.
yeah, just a minute. Just give me a minute. Sorry. Okay, can you hear me?
There's slight echo, but go ahead. It's muted.
Yes.
I think sorry about that. I think it's really essential that they learn the practical aspects. HRI, teaches the children about heart functions. So it would be very nice if they could actually learn how to prevent a heart attack, which they're teaching, and the anatomy of the heart, because it is such a preventable disease.
Like the electronics. Thank you, Ms. Renita. Just like the electronics causes problem, the heart also can cause the problem. And now and then it rings the alarm, and children have to be aware of that. And to learn, Pedro, you have a question? I see. You want to ask? Dr. Pedro.
Yeah. Yep. I have a question to Ms. Mirula. Can you please explain what is a heart attack in your words, please?
Ms. Mridula, did you get the question?
Yes. Hello, everyone. So I would like to actually take the words which I used in the school workshops also, and I used to say, if it's a heart attack, it's like you can understand well from the words itself that there's an attack on your heart and or in someone's heart, and it's a medical emergency then. And when we talk about medical emergency, what is happening there? So it occurs basically due to blockage of blood supply to the heart muscle by a clot. So if there is no supply of blood to our heart, then and this clot doesn't dissolve or is removed, then definitely that can lead to permanent damage or even death. So that's how I would say a heart attack can be explained.
Great, Mridula. You are in Delhi and you are teaching children on good health. And what an excellent way of putting it. I'm sure all the kids learned on what a heart attack is. Thank you so much.
Thank you, ma'am.
Ms. Pragra, I see that you have a question. Do you want to go ahead and
yes.
ask?
I had a question for Dr. Terry. If I have pain in my chest, does that mean it is a heart attack? Is that a symptom?
Terry, did you get
so it could be, not necessarily, but it could be a warning sign. And when we talk to patients, we ask about certain things, and there are a clinical classification that we use for chest pain. And so whether it comes from the heart or not from the heart, and we divide that up into typical heart pain, like angina, we call it. And that could be a substernal chest discomfort, could be a squeezing pain. Some describe it with a clenched fist. Some feel like somebody is sitting on their chest. It can last for a few minutes at a time. That's one sign and symptom. The other is it can be provoked by exertion or emotional stress, and it can be relieved by rest. Or some patients have nitroglycerin pills, and that relieves the pain or discomfort. Atypical heart pain or angina meets two of those characteristics. Non-cardiac chest pain meets one or none of those characteristics, and that's how we think about it. There are many atypical symptoms of a heart attack as well that we think about.
Great, Terry. I remember you telling that it was like an elephant sitting on the heart. And you said about the pressure. Terry, I think you wanted to ask something to Pregna, Ms. Pregna.
Yes, I wanted to ask you, can you explain atypical symptoms of a heart attack?
Yes, definitely. Ma'am, it's Pragya, not
Sorry,
Pragya.
I'm truly sorry, Pragya. I think we made a mistake.
Yeah, that's all right.
Yeah, Pragya, I correct myself.
At HRI, we were basically taught that we can remember the symptoms of a heart attack by the acronym LISTEN, wherein L stands for lightheadedness, I stands for increased sweating, S stands for shortness of breath, T stands for tightness or pain in the chest, E stands for extension of the pain to other areas like neck, jaw, etc. And N stands for nausea and vomiting. So that's what I remember from that workshop, which was like very enriching and informative.
Thank you.
Thank you
so much. So when they are short of breath and unable to speak, so don't make them speak, make them rest. We see that Ms. Preeti from Ramaya Vidya Niketan has a question.
Dr. Pedro, sir, can we give water to a person who is having a heart attack?
Dr. Pedro, Preeti has a question for you. Thank you, Preeti. Excellent question and a common thing that everybody asks. Dr. Pedro. I think, can you hear me, Dr. Pedro? Do you want to answer that, Terry?
Sure, I can answer that. So,
Sure.
So scientifically, there's no reason why one should deny water to a patient who wants to drink water, but one should not force them to drink either.
Great. Does that answer your question, Preeti?
Thank you, ma'am.
Great. Ms. Kanchana, now I think you have a question for Dr. Geetanjali. Go ahead.
Good evening to all the panel doctors. My name is Kanchana Kumari, and I would like to ask one question. That is, what is cardiac arrest?
Dr. Geetanjali?
That's very nice.
That is one of the difficult questions.
Excellent question. If we have to save precious life, it's very important to know what's cardiac arrest and how to recognize it. So basically, cardia means something related to our heart. Arrest means, you all know, police arrest means stopping somebody from doing things. So cardiac arrest means the heart stops. And you know, the heart is the most important organ in the body. So without the heart, nothing can work, including our brain, our lungs, our whole body, muscles, nothing can work. So when the heart stops, that is when the cardiac arrest happens, somebody who's standing or sitting can suddenly collapse. Or if the person is already lying down, can become still and not able to move. Or you can't see the person breathing, or sometimes they can even gasp. That's the danger sign. So basically, if you see all these, then the person is having cardiac arrest. Now it's important to know how to learn how to manage cardiac arrest. Over to you, Aruna.
Thank you.
Does that answer your question?
Thank you. Thank you, doctor.
Great.
You're welcome.
Great. That's nice. Marcia, I think you wanted to have a word. Go ahead, Marcia.
I do, thank you. You know, one of the most important components of what we do is bystander response. And in the HRI training that we did for the school children, we did some of that. And I thought that Hari Prasad ought to talk a little bit about how we did bystander training in the training for the school children. Hari, would you talk about that, please?
Yeah, thank you, Marsha. So from the very outset, Dr. Aruna and the rest of us here at Rescue India team, we felt strongly that bystander CPR training must be a very important part of the school modules. Of the 10 modules, the 4 of the modules deal with the bystander CPR training. So that's the level of importance we have given it for this. And we strongly felt that we didn't want to do just walk into the schools, just do a feel-good event for 1 hour where we just hand them a mannequin and they do compressions and we just walk out. And at the end of the day, they're not sure what they learned and we are not sure if they learned it either. So what we designed a very comprehensive, robust program which has a pre-assessment, a post-assessment, and a very clear acronym of a 3C and a 4C approach, something that they can remember as they go on to become adults. And also, essentially, we wanted the children not just to be learners, but also become trainers in a way for the rest of the community, because this is one way where the child goes and talks about CPR to an adult, or if they're in a situation, they'll not only be able to perform chest compressions themselves, they'll also be able to guide the adult in the situation to do that. So I think what was one of the most fulfilling things that we did among the rest of the modules, because it was very active and very uniquely so. It was a one-on-one training. Each of the students learned chest compressions and the steps of CPR with a 1:1 instructor ratio, which was something I feel very proud about our program. Thank you.
Excellent, Dr. Hari. Dr. Prabhakar, do you agree with that?
I have a question for Mrunalini. So Dr. Hari Prasad just talked about 3C. Mrunalini, could you please help us understand what 3C stands for?
Well, thank you, sir, for the question. So the 3C approach is basically a 3-step approach. Firstly, we need to check the pulse of the victim who has collapsed. And if the victim does not respond, or if the victim is not breathing, then the second step would to be call for help. Then the third step is to perform chest compressions, which need to be started hard and fast by placing the heel of the palm at the center of the victim's chest and performing steady compressions of about 100 to 120 compressions in a minute. That is what the 3C approach is.
Excellent, Rolani. Except that when you check, I think we should just check for response and avoid checking for pulse, because it's a little difficult. So we, though it was there before for checking for the pulse recommendations, but currently we are not recommending for checking the pulse. So you just check for the response. If the patient is not responding, not breathing, go ahead, call for help and start the compression. Dr. Pedro, have you come back?
Yeah, sorry, I had a problem with the internet, and now I'm back. And I have a question regarding the 4C student, Master Kuku student. What is the 4C approach? Can you please explain, please?
Yes, sir. Thank you for the question. Yes, it is as similar as 3C. And if a victim is collapsed, is a 4C. Of the first C represents to check the response. If we ask, are you all right? There is no reply, and you should check the breathing. The 3 things we should remember in this process. First to feel, listen, and listen, and to look at them. I should breathing the movement of the body, and the second thing is to listen what they're saying, and listen the movement of the breathing what they're taking, and we should feel the breath. We are to our face what they breathe in that situation, And the second C represents to call to toll-free number ambulance 108, and to ask to somebody to get AED kit. And the third C represent to compress the chest, as the last caller said, and we should compress it hard and fast. Fast mean we should compress two times per second, that is 100 to 120 times per minute. And hard means it should compress to 5 centimeter down, and you should get back. And the fourth C represents to connect the AED kit as it is instructed by it, or if there is no AED kit, continue doing CPR as till the ambulance arrive there. Thank you for the question, sir.
Great, Gokul. Dr. Hari Prasad, do you just want to reinforce?
I think he got it absolutely right, but except the first stage is we will stick to checking for response, and in this person there's no breathing, so no response and no breathing, you go to the next C, that is call for help. Thank you. Good job, Gokul.
Thank you, sir. Thank you very much.
Thank you, Hari. So I see in the chat box, Dr. Naresh Shetty has a question for Ria. Ria, we know that you are a yoga teacher. This is your hobby. And we hope that you will be able to explain to the kids how physical activity plays an important role in the prevention of heart disease.
Physical activity. Children who are active and start habits young become fit and healthy adults. Please know that physical activity can be recreational, like swimming or dancing or outdoor activities. You can have organized activities like football or cricket, or competitive sports, and yoga, of course. How much physical activity do you need each day? Well, it is recommended for 60 minutes. You don't have to do it all at the same time. You can split it up throughout the day. Physical activity will help you relax. It will reduce your stress, and it will help your overall well-being. So thank you so much for that question.
Thank you, Ria. So, Mrs. Kanchana.
Vijayamani.
Okay. Mr. Vijayamani, you want to add something to that about the aerobic exercises?
Yeah. Thank you for inviting me to join this seminar first thing. Very good evening to all the panel doctors. We are fortunate to get associated with HRI, which made our students awareness about heart-related issues. When they come and taught our students were made to measure their pulse rate and then made to do 20 squats. Students measured their pulse rate again, and upon finding that it has increased, it served as an opportunity to reinforce the importance of aerobic exercise and a healthy heart. We also have regularly practiced yoga, through which meditation is practiced to gain mental health, and regular exercise to keep body fit.
And of course, aerobic exercise are very important for the kids and keep body weight, better heart and lung fitness, and bones and muscles healthy. Fever symptoms of depression. Exercise makes the children to lower the body fat and become stronger, healthy adults. And of course, they'll have very good blood circulations, air circulations, and life force and circulation and energy circulations, which help them to become fit and healthy in their life. Thank you.
Excellent. Mr. Vijayamani and Mrs. Kanchana, excellent.
Thank
you, ma'am.
Thank you, doctor.
So, Miss Meera has a question.
Yes, ma'am. Good evening to everyone.
Yeah.
My question is to Dr. Nayanjit sir, and this is regarding and advice on a balanced diet to have a healthy heart? What should be the balanced diet for a healthy heart?
Yeah, thank you
Dr.
for
Nainjit?
thank you for asking that question. That's one of my most favorite questions any day. Any day. Yeah, so, well, let me see if I can do justice to your question in a language that is more palatable to the children as well as, people in general. So a balanced diet is one that provides us all the necessary nutrients that we need through our menu of food for our own growth and development. Which in very simple terms, it means a balance of proteins and carbs and fats and vitamins and minerals. But then to really choose a balanced diet for practically preventing heart disease is really complex in this market-driven world. Everything is decided by the market. So I can quickly give tips about what balanced diet people can choose. So for example, avoid or be at least moderate on the processed whites. So all the processed whites are actually a no-no, but in today's world, you can at least moderate. Anything made from sugar or white rice or white flour or trans fat or vanaspati or salt, everything in all these in excess is definitely anti-heart. What can you add to your menu? You can add to your menu all naturally colorful foods. Your plate should be colorful, particularly for children and adults, so that you can build a healthy heart. All kinds of veggies and all kinds of fruits in plenty, nuts, whole grains, pulses. Of course, anything in excess will be difficult to even sort of digest. But a balanced mix of all of these. For those who love non-vegetarian food, fish and poultry are fine. But then processed meat is better avoided or eaten in moderation. So if you can make a choice based on these guidelines, I think balanced diet is not difficult to achieve. But I also know how difficult it is for schools to really sort of educate their children, or even provide avenues in the schools for access to healthy or balanced food. I don't know. I think there are teachers here, maybe from Gyana Teja School, Miss Prerna or Chetana. If you can tell us, how is your school sort of ensuring children to have
Yes.
healthy diet? Yeah, please.
Yes, sir. Good evening, one and all. Myself being a science teacher, I usually talk more about diet food during my class, like what is healthy food and what are benefits of it and what is importance of it. I keep telling every time in my free time. In our school, we advise children to eat more fresh fruits and vegetables rather than junk food. Because we know that children are very much, not only children, common people are very much attracted to junk foods because they taste better. So we recommend parents, or we are giving a food chat. We have made a food chat. So we give, or we recommend parents to send the tiffin boxes according to the food chat, and that food chat usually will be containing at least one fruit or seasonal fruit and raw vegetables compulsory in their tiffin box. And we are rechecking every time about it. And whenever we get to know whether they are following the food chat, we keep on telling the importance of that. This is how we are recommending about the healthy food in our school, sir.
That's very nice to hear. Thank you, ma'am.
Thank you. Thank you, sir.
Yes, that makes it easier for the parents. I think you give a timetable and what they need to send, but I don't know if the children are going to like that. But anyway, Dr. Geetanjali, I see that you have a question. Dr. Geetanjali?
Yes, thank you, Aruna. This question is to Ms. Shaili. The same thing related to food, very challenging question. How did you motivate the children to choose the healthy food? How did you make them learn?
Thank you for the question, Dr. Geetanjali. It is an honor to be interacting with you and all the stalwarts present here. While working with adolescents in different schools, what we realized is that it became eminent to talk to them about their food choices. We thought that was the need of the hour. So as part of a fun activity or fun sessions, what we essentially did was we divided the students into different groups, and each group was given the task of naming 3 foods that were good for the heart and 3 foods that were not good for the heart. So doing this activity actually ensured that the students were able to differentiate between healthy and unhealthy foods. And as Dr. Nayanjit rightly mentioned earlier, one can eat healthy food every day, which is not only good for the heart, but it is also delicious in taste. And by doing that, one can ensure that the heart is healthy as well as the tongue is also satisfied at the same time. So I hope that helped resolve your query, Dr. Gitanjali.
Thank you so much. It's amazing. Really thank you.
Dr. Gitanjali is actually handling children day in and day out. And so it is really amazing the way the teachers and the students are getting back and telling the answers and how they're keeping good health and promoting good health in children, which is very important. Dr. Rakshay Shetty, who is the leading pediatrician in Bangalore, is relatively quiet today. Rakshay, I see that you have something to ask. Go ahead.
Can you hear me?
Yes, please. Yes, please. Go ahead.
Yeah, one of the things what COVID has brought us is essentially a lockdown phase. And what I have noticed as a pediatrician is that a lot of children are actually coming with the weight gain, which is quite significantly harmful, almost bordering towards obesity. And including myself, I have put on a lot of weight over the last few months because of this lockdown. So I just wanted to know, did you get an opportunity to kind of motivate your parents and probably your friends about physical activity?
Pragna, do you want to take this question? Pragya, sorry, Pragya.
Yes, ma'am, sure. Ma'am, I think there are a lot of things that we can do which do not require us to go out, and still I think we can do a lot to exercise ourselves, like we can practice yoga, we can do maybe join certain online sessions that would help us. So I think there's a lot that can be done.
Great, great. That's nice. I think, Terry, you wanted to ask Dr. Rakshay a question about children. Go ahead.
Yes. Thank you, Aruna. Dr. Rakshay, being a children's doctor, do you think children should be taught to use an automatic external defibrillator, an AED?
Thank you so much, Terry. It's a good question. And oftentimes we kind of focus a lot on healthcare professionals about CPR and use of AED. But I think there are enough studies to show that children too can be taught these skills. And anybody who's beyond 8th grade could be taught how to provide an effective CPR and how to use AED. And I think that's an important thing because in a crisis situation, oftentimes children can direct adults about how to use them. So absolutely, and I think that is something that can be taught and probably useful if it is taught.
Thank you.
Ria, I think you have something you wanted to mention. Go ahead, Ria.
I do. There are things that we can do to modify our risk for having a heart attack, and I wanted Dr. ZJ to explain some of those things that we can modify to reduce our risk.
Yes, well, thank you, Ria. This is a very good question. Well, certainly for every individual, and we do have, when we getting old, and we tend to have the higher likelihood of have a heart attack. But many things that we can change to avoid heart attack or heart disease. For example, the main risk factors for cardiovascular disease or heart attack, including high blood pressure, let's say, and high cholesterol or a lipid problem, which is it's a fatty or cholesterol problem in the vessel. And if you are in an unhealthy lifestyle, like taking cigarette smoking, or if you have diabetes, the likelihood to have a heart attack or heart disease will be much higher in the late life, well, late time for your life. Well, keep in mind that heart attack is not only well, it's not really a old people's disease. It could happen at any time. We have seen clinically many patients as young as 30 years old with a heart attack. So healthy lifestyle is really important. And while when you do exercise and keep your diet a balanced diet, the likelihood to have high blood pressure or high cholesterol, high blood cholesterol will be low. So that could help us avoid the possibility of a heart attack. If we don't drink, if we don't smoke, and the likelihood of having a heart attack would be much lower than those individuals who smokes, who drink, and who do other unhealthy lifestyle. So make sure to have a healthy lifestyle as early as possible. Just as your teacher say that, well, eat right, eat more vegetable, and eat more fruit, and do exercise, and also to avoid those unhealthy habits. So that will really take a long time, and this will be important for yourself, and also if you can talk to your parents and your grandparents about this, this will really helpful. Thank you.
Thank you so much. Yeah, I think the children must have understood the importance of eating right. I see from Ramaya Vidyaniketan, Miss Ritika, I think you have been waiting a long time to ask a question. Go ahead, Ritika.
Hello, my question is to Dr. Pedro. How can I recognize a patient is having a stroke?
Thank you for the question. Thank you for the question. This is a very important question since stroke is a main cause of death and disability worldwide. And there is a great mnemonic to remember how to identify a patient with a stroke. In a case, for example, your parents, your family or friends, you should remember fast, because if you identify this patient and you fast go to a hospital, you can reduce the risk of death and disability. And F, you can see by a face drop if there is a difference in the face. If, for example, for a smile is different one side when you compare to other. The other one is A. You can see if there is a difference in the arm. For example, you can put the arms together and one arm will drop and they lost the strength in one arm. And also about the speech, if you ask and they cannot speak properly, you should go fast and call the ambulance. And I think in India it's 108, is that right? To call the ambulance, and you should go straight to the hospital. It's time to call. So the fast would be the face drop, the arm weakness, speech problem. It's time to call because you need to go fast to solve this problem. So thank you very much for the question.
Ritika, that answers your question?
Thank you, sir.
Thank you, Ritika. Dr. Hari, you want to play a video quickly?
Yeah, sure. Suhas, I think you have the video. Can you please share the screen and play?
Two days back, one man of 40 years came to our emergency department. After the ECG was done, he was found to be frankly having a cardiac arrest issue, and he arrested. And he was gone in no time. Why did this happen? Simply because he did not think that he will have a cardiac issue. And this happens almost every day, every moment in some part of our country. We need to do something about it. I think when we started the Heart Rescue India, I think our issues were how do we actually mitigate this particular problem? We have come a long way off. My team under Dr. Aruna and her team have ensured that we had community awareness. We ensured that most of our hospitals who actually worked with us together really did a great job in getting the community to understand the need of preventive cardiology.
As you all know, we have taught you about the warning signs of a heart attack. But the saddest part about someone having a heart attack is they can also have what we call as sudden cardiac arrest. Elrigu gottalla sudden cardiac arrest andre? Yes, we have taught you about it. So sudden cardiac arrest alli obradu heart nintogutte. Heart kelsa madade. Obರಿಗೆ heart attack adaga heart nintogo chances irutte. So we will teach you what you need to do when you see someone with a sudden cardiac arrest. Are you ready to learn? Yes. Okay.
Hey, sandwich ಕೊಳ್ಳೇನೋ? ಅರೆ ಮನೆಗೇನು ಇಷ್ಟು ಬೇಗ ಬಂದಿದ್ದೀರಾ? ಕಾಫಿ ಕೊಡ್ಲಾ?
Just give me a glass of water.
ಸುಧಾರಿಸ್ಕೊಳ್ಳಿ, ಅರ್ಧ ಗಂಟೆ ವಾಕ್ ಹೋಗಿ ಬಂದ್ಬಿಡ್ತೀನಿ. Hey, Rohan, come fast, man.
Hey, I'm coming, guys. ಏನೇ ಅಪ್ಪ, ಏನಾಯ್ತಪ್ಪ ನಿಮ್ಗೆ? ಅಪ್ಪ, Vignesh is here. Vignesh is here. Vignesh, look,
Just lay down. Uncle, are you okay, Uncle? Uncle, he's not breathing. Pray, give him a CPR with your dominant hand. No, not like that. Keep your elbows. Download the HRI.
You first calm down. Calm down. ಸ್ವಲ್ಪ ಜಾಗ ಕೊಡಿ. Please allow me to take over.
Do not touch patient. Analyzing heart rhythm. Do not touch patient. Shock advised. Charging. Press flashing button. Shock delivered. It is safe to touch patient. Start CPR.
He's responding. I'll do 12 lead ECG. I'll send to our doctor.
He's responding, Kana.
ಮ್ಯಾಮ್, ನೀವು ಆಸ್ಪಿರಿನ್ ಅಲರ್ಜಿ ಇದೆಯಾ?
ಹಾಗೇನಿಲ್ಲ.
ಯಾವ್ದಾದ್ರು ಮೆಡಿಕೇಶನ್ ತಗೊಂತಿದ್ದೀರಾ ಈಗ?
ಇಲ್ಲ.
ಸೊ ಆಸ್ಪಿರಿನ್ ಕೊಡ್ಬೋದಲ್ಲ?
ಕೊಡ್ಬೋದು.
we are asking each one of the persons who have chest pain to listen to their heart. If you have lightheadedness, if you have inability to speak, or if you are finding it an increased sweating, if you have shortness of breath, if you have tightness in your chest or chest pain extending to your neck, jaws, arm, or back, and if you have any gastric symptoms like gastritis, nausea, vomiting, call the toll-free number or the 108 so that a person who is dispatched reaches your house and is able to do an ECG. Give a chance to the loved ones, give a chance to your family, give a chance to the society. We are here to save lives. Heart Rescue India is here to help you to lead a normal life. So call early and reach the hospital early if you have chest pain.
So we are coming to the end of the program. We didn't realize how the time flew. Dr. Naresh Shetty kept saying, keep smiling to all of us. But then in the emergency department, we are seeing young people dying, coming in late or dying at our doorsteps. And we are not able to do anything for them, to even in spite of interventions, because they arrive late. So watching the loved ones departing so early in life and the effects that it has on the family members is really disheartening for the emergency team. So that's the reason that Heart Rescue India has been given so much of importance. We hope the children of today have learned, the teachers are able to convey this message to all. We would like to thank each one of you, the students, the teachers, the viewers, and the faculty, all the participants, Step 1, and also the PediSTARS for giving this opportunity. As a closing remark and take-home message, Dr. Naresh Shetty and Dr. Prabhakar, do you want to give a one-liner, please?
Okay, one-liner, Aruna. Terrific seminar series. Thanks for conducting. Let's do more of this, because reinforcing these ideas are very important for children to, sustain good practices.
Dr. Naresh Shetty?
Well, despite all the problems in emergency, keep smiling, Aruna. The best is yet to come.
Yes, keep smiling, everybody, but keep a healthy heart. DJ, any take-home message? Pedro? Dr. Pedro and DJ.
Yes, just make sure that we'll keep healthy lifestyle. And
I would like to thank you, Aruna, and all the and keep healthy.
Well, whenever you see a family member or friends or some people on the street, or well, make sure that you use what you learn and help people if you can. Thank you.
Thank you. Thank you so much for all the participants, UIC, Ramaya, Medtronic Foundation, and Heart Rescue India. Wishes all its viewers a healthy lifestyle. Protect your heart. We are here to save lives. Shruti, over to you.
Thank you. Thank you so much for the wonderful session, doctors, teachers, and students. The questions were so relatable, and I think that this was one of the most needed sessions as you mentioned, that cardiovascular diseases are increasing day by day. The tips and the way you explained keeping it so simple was just awesome, and the video at the end made it more appealing. So I thank Heart Rescue India and PediSTARS for doing this session for us, and everyone for taking the time of a busy schedule and coming here and doing this wonderful session. I think we should do more such sessions Stay tuned, dear viewers, for yet another interesting session by Dr. Geetanjali here and the team of PediSTARS on breaking the barriers in simulation training. Virtual reality of episode 2 coming on the 2nd of October. Thank you all for joining us, and follow us on Facebook, Instagram, LinkedIn, and Twitter. And for more information on Project Step 1, visit www.projectstep1.org. You can find information on how to volunteer for Project Step 1. And doctors, you know what to do. Your 30 minutes can save lives. So please do give Ms. call on the number mentioned on the chat box. Thank you so much, doctors. Thank you for doing this session.
Thank you. Thank you so much. Take care.
Thank you. Thank you.
Bye-bye.
Bye-bye.
Bye, everyone.
Bye-bye.